This is going to be a shoulder external rotation sequence. We're going to go from mobility to working on a little bit of muscle control. I did this with a patient today. It worked pretty well. So I'm going to use something stick-like. I'm going to have my elbow a little bit below shoulder height, and I'm going to use my bottom hand just to gently guide my arm up into this external rotation. I want to do my best to not let it fall this way. I want to try to position my elbow so it's close to even with my body. And I have this little bit of an up and out angle just to where I feel a little bit of stiffness and or pain and back out of it. So this will be step one, right? Step two, I want to see if I can actively move into that range. So as I rotate, I think about a little bit of pressure down into my elbow. I tend to want to turn my thumb like I'm doing right now, which kind of facilitates more external rotation. And as I do it, I'm really watching that there's no shrugging the shoulder upwards. So I tell people to lightly pull down on the elbow as you're bringing your arm back to try and engage a little bit underneath the backside of your armpit, right? So that's step two. Step three is I want to add a little resistance to it. So I'll take a band and I'll wrap it around my hand, okay? And I can just take the band and kind of anchor it to my opposite thigh, right? And same idea, I'm pressing a little bit down because now with a band, I want to make sure there's not tension on the top of my shoulder. So it's a little bit of that elbow drive down as I rotate back slowly. This is one that, if the band is a little bit too stiff, they might not get through the full range. And that's okay. Or if they get pain, I tell them to stop short of pain. Now the last step is I call this like reverse arm wrestling was the term I used today. So before I put tension on the band, I'm going to get my arm to that end range position. Now this hand is going to apply some force trying to pull it out of that position. So I start with a little bit of pressure down into my elbow. I'm going to pull with this hand, and I'm going to let this hand slowly win. So I'm really going to slowly rotate, more of an eccentric load for the back of the rotator cuff. Really super slow. I kind of keep the reps low on this, maybe just 5 to 10. Release tension, get it back up there. If they're really getting tired, they might have to kind of put it there with their other hand. A little bit of downward pressure. Slowly resist it. Super slow, maybe even only 5 reps. Really trying to control the speed at which you come down.